Hi everyone, my name is Amira Nazar and I am here on behalf of the CARA Autoinflammatory Diseases Group to share with you the findings from an online survey that was conducted to learn about the experiences of the patients who have systemic autoinflammatory diseases during the COVID-19 pandemic. It was rapidly noted that the patients who had worse outcomes with COVID-19 illness had exaggerated inflammatory responses. This became worrisome for patients with autoinflammatory diseases, their families, and medical providers. The purpose of the survey was to determine if the patients with autoinflammatory diseases experienced changes in the flares during the pandemic and to assess the outcome of SARS-CoV-2 infection in these patients. The questionnaire used the SurveyMonkey platform and it was distributed through social media. The data analyzed was collected from January through May of 2021. It included questions about sheltering practices, changes in the frequency of flares and fever patterns, changes in medications, challenges in access to care, and experience with SARS-CoV-2 infection. A total of 647 surveys were submitted, one for each family, with at least one affected family member, which accounted for approximately 762 patients. After exclusions, the analysis included 486 surveys with 593 patients. Regarding the specific diagnosis of the participants, 40% had a diagnosis of CAPS or cryopyrin-associated periodic syndromes, undifferentiated systemic autoinflammatory diseases, and periodic fever, aphthostomatitis, pharyngitis, and cervical adenitis or PFAPA. 56% of the respondents experienced no change in the frequency of their flares during the pandemic. Interestingly, many reported feverless flares and even lower temperatures with their flares. In the table of outcomes from SARS-CoV-2 infection, we can see that less than 10% of the surveyed had presumed or confirmed SARS-CoV-2 infection. Of those, less than half experienced flares of their baseline autoinflammatory disease during or after the episode, and also less than half reported post-COVID symptoms. Most patients had no change in their baseline frequency of flares despite sheltering in place with a secondary decreased exposure to environmental elements. Overall, the patients who had presumed or confirmed COVID-19 did well and for the most managed it at home with mild and moderate symptoms. Last but not least, we thank to the collaboration and work of the patients, their families, the patients' organizations, especially the Autoinflammatory Alliance, CAIS, and the support of the Arthritis Foundation to CARA.